So today we're going to show you some draping techniques and draping demonstrations. So we're going to start out with the client in the prone position. Prone means face down, okay? So we have our client here. Whenever the client is in the prone position, you want to put a bolster underneath the client's ankles, okay? So here's our bolster. You can cover it with a pillowcase. If that's not available, you can put it underneath the bottom sheet so that the client's skin is not lying on the vinyl. Okay, so I'm going to show you how we do that. Real simple. I'm just going to, so you can see the client's feet. Okay, I'm just going to reach underneath the sheet. Okay, lift up the client's legs a little bit and make sure that this bolster, you can put it in position if you need, so that the feet are lying down in a neutral position. You don't want the feet flex like this, okay? You want them as much in a neutral position as possible. So underneath the ankles, not up here underneath the top of the foot, okay? All right, so we then cover up the client. Remember, we want to keep the client covered whenever on any particular body part that we're not working at the time, okay? So we'll start with the back, okay? Whenever you do draping, you want to make sure that your top sheet is pretty much even all the way around the massage table, because not having enough sheet on one side is going to give you problems later, as well as having too much on another side, and you're going to be fumbling and trying to straighten everything out. So before you get started, make sure your sheet is nice and neat, and you want also a pretty significant,
should I have both my arms here?
No, you're fine. A pretty significant fold in the top of the sheet, because you're going to need this extra material later on, okay? So let's do the back drape. This is really simple, okay? All we have to do is take the sheet from the top, fold it down, okay? And we want to fold till you can feel, just palpate your client and feel the iliac crest at the top, okay? You want to be able to gain access to the iliac crest and the top of the sacrum here, okay? So we don't want to expose any of the glutes, because we're not going to be working on the glutes right now. We're only working on the back, okay? Once we have it folded down to where we want it, then you're going to want to tuck in on each side around the hips, okay? So the best way to tuck is to grab the bottom sheet, okay, and hold it nice and secure, and then with your other hand press down into the table and then underneath the client's hip bone, okay? And then you're going to want to walk around to the other side of the table and do the same thing on the other side. Never reach across and do this. This is very invasive. This is an invasion of the client's personal space. So always want to walk across to the other side and just do the same thing. Okay. That's the back drape. Okay. Now you have access to the client's back. Whenever you're doing the back, the client can hang their arms down up at the top if they want. When you're starting to work on the shoulder, it's best to have the clients come and lay their arms on their sides so that the scapula and the shoulder muscles are in a neutral position. Okay. So if the client already has their arms up to their side and not hanging down in the front, then all you have to do is, once you pull the sheet down, that stays the same. Then I'm going to take the client by the forearm, just move it out, hang it down to the side just for a few minutes, tuck, and then you may gently put the client's arm back to their side. I always like to do this for my clients so they don't really have to do anything except relax. And then gently, make sure you gently place it back onto their side, okay? All right. And then to redrape the back, okay, again, just move the client's hand out to the side, pull the drape towards you, okay? Do the same thing on the other side. Remember, never reach across. Okay. and just fold back up. Okay? That's the back drape. Now we're going to move on to the leg. Okay? So what you want to do for the leg, we do a technique here called the diaper drape. The diaper drape really is the most secure kind of leg drape. It's pretty much guaranteed that there's really not going to be any exposure for the client except for the hip and the leg. Okay? This is also a really good drape to use if you're going to be doing a lot of stretching and moving of the client's limb as well. Okay? So what you want to do, make sure everything is even all the way around. Okay? Then I'm going to take the edge of my sheet, okay, and I'm just going to grab this a little bit at a time. Okay? Don't lift the sheet up too high. You want to stay close to the table. If you lift it up too high, obviously you're going to be able to see underneath the sheet. Okay? So I just want to gather this and then just lie it loosely in between my client's legs. Okay? I have the edge of the sheet on the top so it's accessible because this is what I'm going to grab. Okay? Then I'm going to want to pick up the client's legs. Okay? So I want to slide my inside hand. I'm going to be facing the client's head. I want to take my inside hand and just slide it from the ankle all the way up and cradle the client's knee in my hand. My forearm is going to provide support for the lower leg. Okay? I'm down in my squat. I'm not bent over at the back. I'm down in my squat. Okay? In my lunge. Okay? So now all I have to do is just stand up and the leg comes with me. Go underneath the leg, grab the edge of the sheet, pull it towards you and up towards the hip, and then go back down in your lunge to drop the leg. So we want to take the edge of our sheet, okay, and I'm about right here at the calf to the knee, okay, and I want to gather the sheet, keeping the edge of it on the top. So gather the sheet, again staying close to the table. We don't want to lift up too high because then the client will be exposed, okay. Then I'm just going to lie it loosely between the client's legs, okay. Now I'm going to have to pick up the leg a little bit in order to get the sheet wrapped underneath around. So I'm going to take my inside hand, I'm going to be facing the client's head, take your inside hand, okay, and I want to just slide it up underneath the client's knee so that my hand is supporting the knee, my forearm is supporting the client's cruce or lower leg, okay, I'm in my lunge, okay, I'm not all bent over at the back, I'm in my lunge, so from here all I have to do is stand up, and to do that all I have to do is drag my back leg towards my front leg and the leg will come up with me, okay? Then just reach underneath, reach for the edge of the sheet, pull it towards you and up towards the hip, okay? And then just go back down into your lunge to lower the leg, okay? Once I do that, okay, then I can grab this part of the top part of the sheet coming over the back of the leg, pull it tight against the thigh, and slide it up towards the client's hip, okay? How far you slide it up will depend on what kind of work you're doing, okay? If you're just doing leg work, then you want to come up here towards the hip, right here, and you'll be able to feel the greater trochanter. You want to make sure that's exposed. I feel like this is a good spot. I can feel the greater trochanter. I can feel the ischial tuberosity. All of that is exposed. So I'm basically at this part of her hip. Okay, so again, grab the bottom sheet and then push down into the table and underneath the client's hip bone right there. Okay, that's your ASIS. Okay, and that'll give you a nice secure draping for the leg. So to undrape the leg, what I want to do first is just come up here to where it's tucked at the hips or the waist. Just pull this out, let it hang down the side. Don't lift it up or anything. You want the client to stay covered. Okay, and now I'm going to have to basically do everything I did in reverse. So I'm going to lift the leg just about an inch or so. So again, coming underneath the cruce and having my hand come up and cradle the knee, the forearm cradling the lower leg in my lunge. Okay, so then I can just stand up, just pull the leg up a little bit, pull the bottom part of the sheet down, and then pull it over. Okay, so now